In the world of medical science, mechanical ventilation stands as a life-saving intervention. It's a method of assisting or replacing spontaneous breathing when a patient's respiratory system fails. This mechanical process supplies oxygen to the lungs and removes carbon dioxide, allowing the patient's body to focus on healing and recovery. But the goal, of course, is to get patients to breathe on their own again, and that's where extubation comes into play. Extubation is the removal of the breathing tube, or the endotracheal tube, from a patient's airway once they no longer need help with their breathing. It's a critical step in the patient's journey to recovery. So how does extubation work? First, the healthcare team carefully evaluates the patient's readiness for extubation. They take into account several factors such as the patient's level of consciousness, ability to protect their airway, and overall health status. It's a decision that is never taken lightly. Next, the medical team prepares the patient for extubation. This involves explaining the process to the patient, suctioning secretions from the airway, and positioning the patient appropriately. Then, the actual process of extubation begins. The cuff of the endotracheal tube is deflated. The patient is asked to take a deep breath, and as they exhale, the tube is gently and swiftly removed. The patient is then encouraged to cough to clear any remaining secretions. After extubation, monitoring is crucial. The healthcare team keeps a close eye on the patient's breathing, heart rate, and oxygen levels. They also assess the patient's comfort and ability to speak and swallow. So, to summarize, extubation is a vital process in a patient's recovery from respiratory failure. It involves careful evaluation, preparation, the actual act of removing the breathing tube, and post-extubation monitoring. Each step requires skill, precision, and a patient-centered approach. Remember, while extubation is a positive step, it's not without risks. Potential complications can include difficulty breathing, damage to the airway, and reintubation. Therefore, it's essential for the healthcare team to be ready to manage these potential issues. In the end, the goal of extubation is to help patients regain their independence and return to breathing on their own. It's a step that symbolizes progress and hope in the face of medical adversity. And it's a testament to the skill and dedication of the healthcare professionals who make it possible.